My task is to preside over a panel of eminent speakers, and I believe we have 25 minutes because of the economy of the session. We'll be focusing on the impact of COVID-19, the pandemic, and the vaccination responses and healthcare responses to that on society and the economy, as well as also strategies for dispelling some of the myths that Minister and a number of other colleagues had spoken about earlier on. And so essentially two aspects. The one, of course, is one that we've done a reasonable amount of work through the HSRC and also the National Institute of Social Sciences and Humanities, and also a number of other entities in government and also in civil society on monitoring the impact of COVID-19 on different communities in society, and also how these communities have responded to this. And we're trying to look at what does the latest and the most recent data and the evidence suggest about the distributive and differential effects across different fault lines in society, because I mean, it's not very useful to use the notion of society as a kind of a homogeneous social construct. We have to look at how these differential effects play out across different racial or ethnic, gender, age, demographic, class, and of course spatial lines as well. How different segments of the community have been differently affected by the grip of the pandemic, and of course responses thereto as well. And what are the different strategies that have been used by social forces? So we assume people are agents and in making and remaking their futures. How are they organized, and how have they gone about responding to this so-called new normal? Strategies for building resilience, survivalist strategies of cooperation, and of transitioning to a kind of a new a normal as well. Now, how do we make sure that the response that government has now announced to the President, the Economic Recovery and Reconstruction Plan, that process is not, again, like in the case of the PPE fiasco, cannibalized almost by elites and corrupt agents away from the benefits that it's supposed to accrue to the poor and the marginalized. Or to put it the other way around, how do we make sure that the poor and the working class and the marginalized sectors of society can exploit the opportunities available in the ERRP? So for us, that would be important consideration, and some of our colleagues will hopefully speak to these issues. The second one is to do about myths, and both COVID-19 myths about viruses, but also myths about pandemics and public health responses to that, and its effects on our efforts to overcome the pandemic and the social and economic crisis that this has precipitated over the last 2 years as well. There are, of course, major policy concerns in the policy community about the persistence of numerous of myths that are, or unsubstantiated claims, as some colleagues spoke about, and how these myths are preventing the normalization of economic and social activities in society as well. The notions of the virus as a hoax, virus caused by fifth generation technologies. I think one of our colleagues may speak to this issue, the virus caused by GMOs, genetically modified organisms, and all sorts of leaps of science and claims made, or even religious or eschatological claims about the virus, as well as also cures to the virus itself, completely unscientific claims as well. Now, the political effects of these myths in South Africa may not be, arguably, may not be as severe in terms of their national political expression as is, for example, was the case with the Donald Trump movement, where a significant section of the right-wing movement in the Republican Party, as represented by Donald Trump, argued and articulated and advocate this sort of anti-vaccine movement. But nonetheless, if we do not deal with this in an effective way, we stand the risk of eroding the efficacy of public health management interventions, as the DG spoke about, It could lead to the persistence of infection, rates in the country, despite the fact that we have, the best of science and technological tools available. It could stunt the efficacy of the vaccination strategy. And of course, ipso facto, then delay the recovery and reconstruction efforts underway as well. My own view is that we need to think about the antivirus, anti-vaccine myths, in a broader context, because it may well be tied up with a broader anti-science and anti-technology sentiment emerging sections of society, both global and also local. And at the roots of this skepticism about the claims and the hopes and the optimism about modern science may well be tied up with the failures of our science and technology systems, and system in South Africa in particular, and the political economy around which it is wrapped around it, not only to explain, but also to demonstrate its benefits to particularly the poor, the failure of the system to be able to live up to the promise that science and technology professes that it brings to society. And it's an interesting paradox, a contradiction, that in the last 20 or 30 years, we've seen a major scientific advances, in biology, in physics, in engineering sciences, computational sciences, and so on, and unprecedented technological breakthroughs associated with these advances in science. And at the same time, it was occasioned by also of the last 20 years about a major economic globalization movement that extruded vast numbers of people from the center of our economies and rendering them workless and unequal, at the same time fueling great forms of social inequality in the world. So the irony is that, or the contradiction is, you have this age of discovery and technological progress on the one hand, and on the other hand, you have masses of numbers of people extruded from the core of the global economy. And my question is that, is it enough for us to simply, at a rhetorical level, in conferences like this, to try to dispel anti-scientific claims, such as the ones that I think rightfully we should dispose of as well, in the name of science and of course modern progress? But should we not look beyond this to redress the failures of the science and technology system and its political economy, its failure to provide pathways for this social distribution of the benefits of science and technology today? In other words, are we not risking speaking again as elites within the system, at the people as ministers warned us, if we fail to transform the political economy of the science and technology system itself, and of course the larger economic system in which it is implicated as well? But my job is to introduce the panelists, and we have 4 distinguished colleagues that I will ask each 5 minutes, if possible, colleagues. Professor Priscilla Reddy from the HSRC, Professor Sarah Mutsetsa, which is CEO of the National Institute for Humanities and Social Sciences, and Professor Tsilitsi Marwala, Vice Chancellor of University of Johannesburg, and Dr. Alexis, I only have his name or surname, who is an economic performance specialist at the HSRC, I believe, as well, to speak to some of these issues as well. So may I ask, without further ado, if Professor Priscilla Reddy could perhaps address us quickly. Thank you. Priscilla?
Yes, thank you. I'm sharing the presentation. Thank you very much, and thanks for inviting me to this presentation. In the interests of time, I think I'm going to just summarize several of the slides, but the details are available for the audience and the participants to read and talk about and ask questions. So I was asked to talk about the social and economic impact of COVID-19 with particular relevance to dispelling myths. The COVID-19 pandemic has had a profound social impact on all South Africans and all over the world. And this is very important to consider when you try to dispel the myths around COVID and COVID-19 vaccination. If these myths are not dealt with, we will find that vaccination coverage will fall short of the 67% that's targeted. We will also find that the virus will be widely transmitted as we move forward. COVID-19 and lockdown fatigue will ensue with reduced adherence to the social behavioral interventions. We've also heard about the mutations from our colleague earlier on. These strains will continue to develop. And more importantly, there'll be a reluctance to accept the annual COVID-19 vaccination, similar to the one for influenza. What happens as a result of all of these? Health inequalities will arise between those who have easier access to the annual vaccinations through the medical aid schemes, and the 93% of the population who do not have medical aid will have lower vaccination rates. So I would like to go into detail into the economic impacts, individual financial pressures, food security, psychological impact, infections, deaths and bereavement, fears, knowledge manipulation, and blatant misinformation. However, I'm going to go very quickly through these slides and go through the other slides. So as we all know, 7.2 million in the last quarter have been unemployed. We also know there's been a loss of income that's increased. We also know that salaries have taken cuts, both for paid and unpaid workers. Very, very early in the epidemic, as Professor Derek Swartz knows, the HSRC engaged in some major population representative surveys. Again, to summarize here, what we found at the early stage of the epidemic were heightened fears of job losses, pressures for breadwinners to support their families over a prolonged period. New data shows that all these numbers have increased. Almost 1 in 4 people say that they do not have enough money to buy food. During the first stages, we know that's increased. 16% of households reported that their children were hungry. And I just want to quote, even in the interest of time, this important quotation that came through from a community health worker. It has a big impact because others are unemployed. Others have casual work. Since they have casual, there's no food, there's nothing. No food, parcels have come this side. And so people are starving. And even in the street vendors had to sit with their stock until it became rotten because of a lack of income. If we look at the psychological impact again here, I'm going to go very quickly through the slide. From July to December, the percentage of South Africans screening positive for depression increased from 24 to 29%. November, December, 2 in 3 South Africans reported experiencing hunger every day, had depressive symptoms. These are serious mental health issues, colleagues. Healthcare workers, particularly nurses, reported very high rates of psychological distress. We're doing more health worker surveys now, and we'll look at this in further detail. If we look at infections, death, and bereavement, this is a really, really sad slide. We see over the past 3 to 4 months, the total number of COVID deaths doubled from 20,000 to about 49,000. And we had more mourning the loss of loved ones, highly challenging as people received less in-person support by mourning in isolation. This has become the liability of not being able to perform funeral rites adds another layer of grief, which is prolonged. Again here, I would just like to quote from Marie Curie when we're looking at balancing of information and how misinformation is rising, whether it's the Trumpites or whether it's in our own country via social media. Nothing in life is more to be feared. It's only to be understood. Now is the time to understand more so that we fear less. It's important for social science and humanities to collect data from our people so we kill and put a stop to the fears and the conspiracy theories that seem to progress. Now to talk about the vaccines and variants from a social science perspective, dispelling the myths. Vaccination, as we all know, is a very important method of preventing infectious diseases. And it's second only to clean water in terms of its public health impact. Myths concerning vaccines are damaging. Even as the availability of vaccines increase, if people do not accept the vaccine because of these myths, we're not going to win against this battle. The negative aspects of vaccines, unfortunately, tend to get more more publicity than the positive aspects. If we look at a Medline search done over the past 5 years, and we put in just two or four words, vaccine risks, it scored 2,655 hits. Vaccine benefits, 557 hits. So what I want to say here is the health education and health promotion COVID-19 vaccination strategy is key, in addition, of course, to the logistic and health systems interventions. A very, very important slide, I think this one, and Professor Swartz alluded to a lot that's in the slide. We need to look at the issue of public confidence and trust in social and health and communication interventions. This is a devastating and scary epidemic and should not be aggravated by the types, methods, and styles of information that the public are exposed to. The public should be convinced that the purveyors of information have their interests at heart rather than pursuing personal gains and self-interests. Controversies and arguments concerning the science and the strategy should be held discreetly, as this can further increase confusion, fear, and breach trust. Unclear messages from governments and any healthcare organization will adversely affect adherence to the lockdown measures. We had a wonderful talk on the genomics just now. If I can look at the social science of that data suggested that the first variant was found here in South Africa. Whether it's of South African origin or not, we don't know, but it has resulted in increased transmissibility. We found that the AstraZeneca vaccine was imparting less protection, so the government started the immunization with the Johnson & Johnson vaccine. However, what happens at the end of all this? Stigma. The 501v2 has been detected in, I think, 46 or 46 countries, and yet South Africa has been stigmatized by naming it the South African strain, in the knowledge that the coronavirus will continually mutate, as we've heard, in multiple locations around the world. This is important to recognize, acknowledge, and hold, because this kind of stigma has serious social and economic impact. As we know, the socio-behavioral interventions were there, and these helped a lot and will continue to do so in the era of vaccination. However, the danger here is that as vaccinations increase and as myths increase, adherence to social behavioral interventions may weaken. And these remained key to the epidemic until we get the 67% targeted population immunized. Then I just want to mention, because I don't see talked about much, super spreader events such as the rage parties in Ballito, where 18 to 35-year-olds had proved to be super spreaders, but they're targeted to be vaccinated last. I mean, do we follow the Western model, or do we think differently about what we do in South Africa? Thank you.
Thanks very much, Priscilla. Appreciate that. I'm sorry we're in a bit of a time pressure here. I'm going to ask Professor Motsetsa if she can, Sarah, if you can come up, please. Thank you very much.
I will put it on slideshow. Thanks, Derek, and thanks, Priscilla. And I don't want to waste more time. I want to just maybe spend some time on this slide, even though there are a few other slides that I can share. With the time limits that we have, I think from our side, the first thing is that since 2020, since lockdown, we've been doing a lot of research in townships, particularly the 5 townships: Alexandra, Diepsloot, Khayelitsha, Soweto, and Umlazi. We're currently on phase 4 of these household-based research phases. One thing is for us since we've been doing this research, one thing certain that came out very strong from our side is that we know that these townships have particular histories and context. And therefore, we should not be surprised at all, or even alarmed by the myths that go on in these communities. These are not just economic spaces, even though apartheid set them up as economic spaces. These are social spaces. These are cultural spaces. Myths from our side, in looking at the 5 townships, myths could also be from HSS perspective, be seen in a positive light, and we can use that to further educate, because if we don't know the myths, we don't know where the misinformation is coming from. I think from our side, I think we need to welcome these myths. We need to welcome ways in which individuals in different spaces articulate a very complex world. This is the first time in at least in our generation that we are dealing with something as complex as this. So rather than shy away from these myths, I think we need to engage them, but we need to engage them again as the minister, and I think Derek also said that, engage them as equals rather than as experts and top down. We know what a vaccine is, and therefore, remember, these are also communities that vaccinate their kids all the time. So it's not coming from a point of ignorance. So I think I suppose my first point around having done this research in the 5 townships is that history is important in contextualizing these myths and understanding context. The second of 5 things that I want to mention is that, of course, what we know is that the pandemic itself has brought to light all the new contradictions, and these are social, political, economic contradictions. However, I think that it is also important for us to think about how the pandemic could also offer us an opportunity for us to reimagine a new society, a new world, working with, as the minister was saying, with our global South partners, the BRICS, our BRIC countries. The one thing, and I'm aware that I'm supposed to talk about the contradictions of, my slide has just stopped. Maybe it's a good thing. All right. The socio-economic and cultural, political, social effects of the pandemic. Just one minute on this slide is that for us, what we've known and we've picked up from the 5 township research is that there is what other scholars have talked about as boundary struggles between the private and the public. Workspaces suddenly shifting to the private sphere. What has that meant for these communities and these households is what we talk about as fragmentation of households and communities in a time where political or community-based organizations are also not able to organize and help. What has also led to what we call the crisis of social reproduction. One is the rise of unpaid work, largely done by women and the elderly, and no wonder we are seeing numbers also in that high numbers of COVID in that age group. What we talk about as the social reproduction, the crisis of social reproduction too, is largely what I think also Priscilla mentioned. Income inequality, unemployment, and food insecurity. What is distinct for us is that most of these communities have relied heavily on the informal economy. And the informal economy, as opposed to the formal economy, has low levels of resilience, and hence there'll be always a crisis of livelihoods for these communities. Ultimately, I think what the research for now is pointing out for us is that, yes, there are these old and new contradictions shaped by race, class, and gender, but this pandemic is also offering us an opportunity to rethink and rebuild our households, families, and society at large. Thanks, Derek.
Thank you very much, Era. Could I ask Dilitsi to come to the panel, please? Thank you very much.
No, thank you very much, Derek. In the interest of time, I'm not going to go through my presentation. I'll just talk over what I intended to take. Thank you very much, Honorable Minister, for organizing this important conversation. So I'm going to focus on the myth around around COVID and 5G. In January 2020, a post of possible connection between 5G and COVID-19 floated on a French conspiracy website called Les Montants Enrages, which loosely translates as the rapid ship. 3 months later, conspiracy theorists making similar claims were setting cell phone towers on fire in Europe, and a year later in KwaZulu-Natal in South Africa. Unsurprisingly, a pandemic like this is a fertile ground for all sorts of conspiracies. As John Cook says, when people feel threatened and out of control, it is natural to want to feel more in control and bring order to the randomness by resorting to conspiracy. Admittedly, there are many great unknowns about the virus, things about mutation, what it means for the vaccines that are going to come into the market, if the vaccines are supposed to deal with a virus that is mutating. All these are difficult questions that we ought to make sense of as we deal with this pandemic. Last year, the Telematics and Informatics Journal found that even among scientists, they were sharing COVID-19 articles, even though they have been flagged as being fake. Though this is troubling, this is a deeply human phenomenon. We become so desperate for answers and for direction that we cling on anything that gives us adequate meaning. Now, why is there such a conspiracy between 5G and COVID? Just coincidentally, in 2019, the first cases of coronavirus were recorded in Asia. But unrelated to that, 5G was also deployed globally in 2019. In South Africa, the first cases of the virus were recorded last year, and 5G began to roll out last year. There is, of course, correlation here, but this amounts to no more into another variant in South Africa, a sign conspiracy theorists took as a confirmation of their misguided beliefs. Now, as the adage goes, correlation does not imply causation. Correlation just means there is a similar pattern or relationship occurring. In this case, we can trace back to 2019 as a common factor. As humans, we are wired to see causation whenever we see correlation. For instance, just to illustrate the issue of correlation and causation. For instance, during summer, people tend to buy more ice creams. And at the same time, there are more recorded cases of children drowning in swimming pools. These two instances are obviously not causal. They are correlated. And the reason for that is because when it is warm, people go to swimming pools, but they also go and buy ice creams. Now, given the fact that this myth do not seem to be going away, even Google search in countries such as Nigeria, Kenya, the US, United Kingdom, India, Australia, searches related to the link between coronavirus and 5G, are still being recorded on a more concerning scale. So this means this myth have to be tackled. A study that was done by the Proceedings of the National Academy of Sciences concluded that like-minded individuals tend to share articles with each other. What this implies is that this creates veracity of shared opinion under the guise of validity, although these views are not scientifically accurate. I think that we ought to guard against is to guard against the so-called celebrities actually becoming part of these conspiracies. Here I'm talking about people such as Novak Djokovic, or actor Woody Harrelson, or singer Kerry Hilson, or boxer Amir Khan. These are absolutely formidable entertainers, but their views on the link of 5G and COVID-19 are not valid. So we have to educate our people that when it comes to matters of science, it is only scientists that they have to listen to. No matter how famous some of these celebrities, the so-called celebrities are, they are just that, celebrities, actors. They are not experts on the issues of science. And the second thing that we ought to do is really this, the DG has been talking about this for quite a while, public understanding of science and technology. We need to intensify public understanding of science and technology. It turns out that illiteracy is no longer just the inability to read or write. Today, you have scientific and technological illiteracy. This means we have to target everyone when we deal with matters of the understanding of science and technology. The coronavirus is a virus. It is a biological organism. 5G is just a progression from 1G, 2G, 3G, still using the same waves. So there is no reason why all of a sudden now an electromagnetic waves can actually has an impact of causing a virus. Of course, these are quite complicated topics. The issues of electromagnetism are not easy. So as we take science into the broader community, it is important that we simplify these concepts. We strip them of their bombastic nature and make them as simple as possible so that our people can be able to understand and can be able to dispel myths and ultimately to confront these pandemics scientifically so that we can be able to go back to normal. So thank you very much, Derek.
Thanks very much, Tshilidzi. I'm so sorry we're having this very truncated session over very important issues. May I just add tongue-in-cheek that I hope UJ can devise a curriculum for celebrities about the uses of science and technology today. I'm saying that tongue-in-cheek. But thank you very much, Tshilidzi, for that input. May I ask just Dr. Alexis to come to the panel, please, colleagues? And I'm so sorry that we have to move the session on because there's one more chunk of speakers waiting for us. Thank you.
Okay, thank you very much indeed. Greetings to everybody with all protocols respected. Just because we have run out of time, I'm going to go quickly over some of the measures that the government has been undertaking to address some of the biggest socio-economic issues that have resulted from the pandemic, because most of those issues have already been highlighted by the previous speakers, so I'm not going to repeat them. Massive loss of employment, so many businesses that have been closing and others that are expected to close, different levels of food insecurity. All of this has been highlighted. But what I want to highlight now is what the government can do about this, because all of this devastation actually calls for intervention. There is a lot of expectation from the government, especially when we see what the Western governments are doing to intervene in order to limit the socio-economic impacts of the COVID. But unfortunately, even before the pandemic, the South African government and the South African economy were not doing well. The South African government, in terms of debt sustainability, it was already incurring a lot of costs for servicing its debt. And the South African economy has been in stagnation for almost a decade, to the extent that the economic growth, the output growth was actually lower than the population growth since 2015. So the government has very limited capacity to intervene, which does not mean that it does not have capacity, but it needs to actually engage with the private sector and the central banks in order to actually have some interventions in the macroeconomic tools before it can have more fiscal and monetary space to alleviate some of the extreme difficulties that have befallen the nation after the crisis, the COVID crisis struck. But another point to consider is that creating jobs costs a lot of money. The calculations that have been made by the Institute of Economic Justice actually point to the region of 6 to 7 jobs created for each million rand of extra spending. So just because we have run out of time, I can refer to the article that has been published yesterday in FEN24, just detailing all of these elements. But I also shared the slides that I had prepared just to show what government can do to alleviate the socioeconomic impact of the crisis. Another point that is very important is to realize that as long as the crisis is ongoing, actually the investment in stimulating the economy would look like just pressing the gas pedal in a vehicle while at the same time having to keep your foot on the brakes because of the security concern. I think I can stop here.
Thank you very much, Dr. Alexis. And once again, apologies to the panelists and also the audience for the time economy that we have. And so thank you very much to all the 4 colleagues.